Hi everyone, welcome to the channel. Here's a detailed exploration of the 20 dangers associated with excess belly fat, summarizing the risks and providing additional information for each. Increased risk of heart disease. Excess belly fat is strongly linked to an increased risk of heart disease. Known as visceral fat, produces hormones and inflammatory substances that can contribute to high blood pressure. High cholesterol levels, insulin resistance, and inflammation, all of which are risk factors for heart disease. Type 2 diabetes. Abdominal obesity is a major risk factor for developing type 2 diabetes. Visceral fat releases chemicals that interfere with insulin function, leading to insulin resistance. Insulin resistance impairs the body's ability to regulate blood sugar levels, increasing the risk of developing diabetes. High blood pressure. Excess belly fat contributes to high blood pressure. Visceral fat releases hormones and other substances that affect blood vessel function, leading to increased blood pressure. High blood pressure strains the heart and increases the risk of cardiovascular diseases such as heart attacks and strokes. Elevated cholesterol levels. Abdominal obesity is associated with increased levels of LDL, bad, cholesterol and triglycerides, while decreasing levels of HDL, good, cholesterol. High LDL cholesterol and triglycerides contribute to the formation of plaques in the arteries, leading to atherosclerosis and an increased risk of heart disease. Stroke. The combination of high blood pressure, diabetes, and high cholesterol resulting from excess belly fat increases the risk of stroke. Stroke occurs when blood supply to the brain is interrupted, leading to potential brain damage or even death. Visceral fat contributes to the development of these risk factors, increasing the likelihood of stroke occurrence. Sleep apnea. Excess belly fat can lead to the development of sleep apnea, a condition characterized by interrupted breathing during sleep. Visceral fat can affect the airways, causing obstruction and disrupted breathing patterns. Sleep apnea increases the risk of heart disease, high blood pressure, and other cardiovascular complications. Metabolic syndrome. Abdominal obesity is a key component of metabolic syndrome. A cluster of conditions including high blood pressure, high blood sugar, abnormal cholesterol levels, and increased risk of cardiovascular disease. The combination of these factors significantly raises the risk of developing type 2 diabetes and heart disease. Increased risk of certain cancers. Studies have found that excess belly fat is associated with an increased risk of several types of cancer, including colorectal cancer, breast cancer in postmenopausal women, and pancreatic cancer. The exact mechanisms are not fully understood, but visceral fat is thought to release hormones and inflammatory substances that promote cancer development. Liver disease. Excessive abdominal fat can lead to non-alcoholic fatty liver disease, NAFLD. Visceral fat releases fatty acids into the liver, leading to the accumulation of fat in liver cells. Over time, this can cause inflammation, scarring, and liver damage. NAFLD can progress to more severe conditions such as liver fibrosis, cirrhosis, and even liver cancer. Reduced lung function. Belly fat can impair lung function, making it more difficult to breathe. Excess weight compresses the chest and limits the expansion of the lungs, reducing lung capacity and efficiency. This can contribute to respiratory conditions such as shortness of breath, asthma, and decreased exercise tolerance. Osteoarthritis. Excess weight, particularly around the abdomen, puts additional stress on the joints, especially in the hips, knees, and ankles. This increased mechanical stress can accelerate the breakdown of cartilage, leading to the worsening of osteoarthritis, a degenerative joint disease by pain, stiffness, and reduced mobility. Gallbladder problems. Abdominal obesity is associated with an increased risk of gallstones and other gallbladder issues. Excess belly fat alters the composition of bile, a digestive fluid stored in the gallbladder, which can contribute to the formation of gallstones. These small, hardened deposits can cause abdominal pain, inflammation, and obstruct the bile ducts. Increased risk of dementia. Research suggests that excess belly fat may be linked to an increased risk of dementia and cognitive decline in later life. Visceral fat releases substances that promote inflammation and oxidative stress, which can damage brain cells and impair cognitive function. Furthermore, excess belly fat is associated with an increased risk of conditions such as high blood pressure and diabetes, which also contribute to dementia risk. Depression and anxiety. Excessive belly fat has been associated with higher rates of depression and anxiety. It is believed that psychological and social factors, as well as the impact of chronic inflammation and hormonal changes caused by visceral fat, contribute to these mental health conditions. Reduced fertility. Both men and women can experience reduced fertility due to abdominal obesity. Excess belly fat disrupts hormone levels, particularly sex hormones such as estrogen and testosterone, which can affect reproductive function. In women, it can lead to irregular menstrual cycles and ovulation problems, while in men, it can contribute to reduced sperm quality and fertility. Increased risk of complications during pregnancy. Excess belly fat during pregnancy can increase the risk of gestational diabetes, high blood pressure, and complications during childbirth. These risks can impact both the health of the mother and the developing fetus, leading to a higher likelihood of cesarean delivery, preterm birth, or other pregnancy-related complications. Erectile dysfunction. Belly fat is a risk factor for erectile dysfunction in men. Visceral fat promotes inflammation and insulin resistance, which can impair blood flow and damage blood vessels, including those supplying the penis. These factors contribute to difficulties achieving and maintaining erections. Chronic inflammation. Abdominal obesity triggers a chronic inflammatory response in the body. Visceral fat releases inflammatory substances that circulate throughout the body, promoting systemic inflammation. Chronic inflammation is associated with an increased risk of numerous health conditions, including insulin resistance, heart disease, cancer, and autoimmune diseases. Weakened immune system. Excess belly fat can weaken the immune system, making individuals more susceptible to infections and diseases. Adipose tissue, including visceral fat, releases pro-inflammatory substances that can interfere with the proper functioning of the immune system, reducing its ability to fight off pathogens and increasing the risk of infections. Reduced quality of life. Carrying excess belly fat can lead to reduced mobility, lower self-esteem, and a diminished overall quality of life. Physical limitations due to excess weight can affect daily activities and participation in enjoyable experiences. Additionally, body image concerns and the social stigma associated with obesity can negatively impact mental well-being and self-confidence. It's important to note that these risks may vary depending on individual factors such as genetics, overall health, and lifestyle choices.